The Health Secretary has announced plans to significantly increase coronavirus testing in the UK. Matt Hancock, who has just returned from self-isolation after contracting the virus, said he hoped that 100,000 tests could be carried out every day in England by the end of the month. Universities and private firms will be called in to help. After days of intense criticism, he admitted there had been big challenges with testing from the outset, with delays meaning previous targets had not been hit. Today it was announced that 569 more people have died from coronavirus in the past 24 hours, bringing the total number of confirmed reported deaths in the UK to 2,921. Here's our political editor, Kuenssberg.
Will there be enough? Not a pleasant process, but a vital one.
This is horrible, and I can only apologise for it.
Because health workers are desperate to know if they have the virus, so they can be, if they can, where they belong, treating patients on the front line.
I just can't see that this is right. We're both keen to work, we're both desperate to work, and as with most GPs, we would work through a minor illness. We don't take time off lightly.
After days of accusations of missing targets and mishandling, the Health Secretary, just back at work after the virus himself, is trying to show the government is getting a grip.
I understand why NHS staff want tests so they can get back to the front line. Of course I do. But I took the decision that the first priority has to be the patients for whom the result of a test could be the difference in treatment that is the difference between life and death.
Privately, the government admits they've been too slow. So now, with help from business and a huge new push, they're setting a vast new target.
I am now setting the goal of 100,000 tests per day by the end of this month. That is the goal, and I am determined that we will get there.
Can you give us a firm date by when any NHS staff that needs a test will get a test? Because in a fast-moving crisis like this, the end of the month is still a long time away.
I will, over the coming weeks, seek to ensure that every NHS frontline staff member who needs a test gets one.
Would you put a date on that? Would you give it a deadline? Because people are very worried about this right now.
Well, they are, and I'm glad that we're able to speed it up. It will absolutely be before the end of the month, but we are, and I'm saying over the coming weeks.
Remember, there are two kinds of test. One to show if you've had the virus after recovering, but the one these NHS staff are queuing up for at a superstore car park turned testing drive-through records if you have the virus right now. If the drivers of these cars are negative, they could get back onto the desperately stretched wards as doctors and nurses. That's why it's so urgent now.
It's very frustrating. We should be the first so that we can look after our patient. I'm very sad.
It's quite efficient, and it allows us to go back to work as soon as we could, really. So that's the best thing we could possibly do for our NHS staff, to be honest.
Testing has become the most acute political problem in this crisis, with the senior Labour MP Dawn Butler, who lost her uncle to the disease, in grief and anger, insisting the government needs to test everyone who works in hospitals without delay.
We're going to need a strategy for community-based testing for really the majority of the population over time, because that is the route out of lockdown.
But a former Cabinet Secretary, no stranger to managing crises, suggests there might be deeper roots to the problem.
Does it seem to you, though, that the government was too slow?
I think when we look back on it, and I think all of us should take a share of the blame here, pandemics, even in my time, was top of the risk register. Did we do enough to build spare capacity? Did we do enough to think that through and actually get the materials in hand, have enough ventilators, have enough protective equipment? Probably not. So, but let's not worry too much about the mistakes of the past.
Even if testing centres become a familiar sight, with no cure, no government can make coronavirus go away. But the actions they take can make a difference to how it affects us all. Kuenssberg, BBC News.
One of Britain's most eminent scientists says the coronavirus crisis has exposed that the country wasn't as well prepared as it should have been. Sir Paul Nurse was speaking as his leading research centre began helping to carry out coronavirus tests. In an interview with the BBC, Sir Paul added that it wasn't the time to go into detail and it was important right now to work together to get through it. Here's our health editor, Hugh.
The first day of coronavirus testing at one of Britain's leading science research centres, the Francis Crick Institute. Labs here used for work in other areas, including cancer, have been switched to analysing swab samples. Today, the government called on academic and industry teams to help in a new national drive to boost virus testing. Had this come a little late in the day? I asked the director, Sir Paul Nurse.
Well, I think that this whole COVID-19 has exposed that the country wasn't as well prepared as it should have been, and that we see that in a number of areas. I don't think now is the time to go into that in great detail because we all have to work together, all put our shoulders to the wheel and get through it.
At this research centre, they've started serious testing today. They hope to get to 500 a day by Monday, and then a couple of weeks later, 2,000 a day. That's equivalent to what all the public health laboratories in England were doing in the early stages of the coronavirus outbreak. A priority now for all labs is testing NHS staff who've self-isolated, so if they're given the all clear, they can return to work more quickly. At Ninewells Hospital in Dundee, they've already started doing that. These doctors and nurses in full protective equipment are caring for patients with COVID-19 in a high dependency unit. It's essential to minimise the numbers who aren't able to work.
It's really important that we test staff. 3 weeks ago, we started a comprehensive programme of testing members of staff so that we could get them to return to the workforce. And as of today, over 700 members of staff from NHS Tayside have been able to return to work, back to the workforce.
And testing is all the more important at a time when hospitals are seeing increasing demands on frontline care. Hospital admissions in England for COVID-19 patients are rising fastest in London. The Midlands has also seen a pickup in the speed of the increase. The South West is the area with the slowest rise in patient numbers. So how does the number of coronavirus deaths in the UK, measured from the 10th one recorded, compare with other countries? Spain has seen a faster rate of increase, South Korea one of the lowest of all the affected nations. So how will the UK get through it all? A question I put to Sir Paul Nurse.
We will get through it, and when we get through it, we will have the potential vaccines, we'll have potential treatments, and we will learn how to manage it if it doesn't go away in the future. But make no mistake, two things: it has damaged us, and the second thing is the only way through this is through scientists and experts finding their way through it.
Drive-through testing centres for NHS staff in the London area have been set up, but this one appeared strangely quiet today, even though many health workers are very keen to get tested. A government source said it was a trial and a little time was needed to get it fully operational. Hugh, BBC News.